Hello and welcome to Thing of the Month. Join us as we take you behind the scenes of Barts Health Archives and Museums to reveal highlights from our collections. This 18th century malt shovel was found in the basement of the west wing of St Bartholomew's Hospital in August 1952. It would almost certainly have been used in the hospital's brewhouse, which began brewing beer for the hospital's patients and staff in 1739. In the traditional brewing process, partly germinated cereal grains are soaked in water and then dried by being spread on a malting floor. As they dry, the grains heat up, which breaks down their sugars and prepares them for fermentation. The malt shovel is used to turn over the grains regularly to make sure they are aerated and heat up evenly. Beer was the normal beverage with meals from medieval times onwards. This was largely because water was so unsafe to drink, but beer was also an important source of sustenance for many people. Alcohol was also believed to be a remedy for a variety of conditions, and so was indispensable to hospitals such as St Bartholomew's. Before the hospital operated its own brewhouse, beer was purchased from external suppliers for the use of patients and staff. This would mostly have been small beer or weak beer of 1 or 2% alcohol, although full-strength beer was also consumed. Until the 18th century, the matron of the hospital could augment her wages by selling beer and ale from a room specially set up for this purpose. By the end of the 17th century, the daily diet for hospital patients consisted of 10 ounces of bread, 6 ounces of beef or mutton, or butter and cheese, and 3 pints of beer. There was also a daily pint of meat broth or porridge with ale. Patients were also given warm medicinal drinks such as caudle or posset, which contained either gruel or milk mixed with beer or wine, and then sweetened and spiced. To combat what we now understand as dietary deficiency diseases, a scurvy grass drink was brewed. Various ingredients were added to 8 gallons of beer, including scurvy grass, a genus of around 30 species of herbs in the brassica family, as well as watercress, horseradish root, sassafras, peas, grains, and herbs and spices, including nutmeg and sage. By 1738, the price of small beer had become too expensive, so the governors of the hospital decided to build a brewhouse on site. In January 1739, Robert Brown was appointed as the hospital's brewer. The brewhouse stood near what is now the entrance to the hospital's King George V building on King Edward Street. The availability of alcohol held some perils for staff, however. The hospital's records contain several references to nurses either fined or dismissed for drunkenness, one with the fitting name of Susanna Careless, and on the 15th of March 1775, a Sister Hester Hill was dismissed for selling gin to patients and otherwise misbehaving. By the 19th century, the temperance movement and medical research into the effects of alcohol meant that many doctors were more cautious about prescribing alcohol to patients. The hospital's rules also clamped down on food and drink being brought into the wards from outside. Patients' diets became more varied and nutritious as the medical understanding of dietetics grew. In 1928, Barts appointed its first dietitian, who designed menus based on different patients' nutritional and medical needs. Alcohol continued to be administered in hospitals well into the 20th century. As late as 1963, a Barts doctor reported that it was traditional to keep a feeding cup, similar to the one shown, on anaesthetic trolleys for the administration of brandy during operations, although he claimed this had not been done in living memory. However, it was not unusual to prescribe sherry before a meal to stimulate appetite, to add brandy and whiskey to hot milk to aid sleep, and to give Guinness Irish Stout, believed to be rich in iron, to pregnant women and patients recovering from operations. With today's increased alcohol awareness, however, these practices are no longer carried out. While beer remained a staple part of the patient's diet, the hospital's brewhouse seems to have been relatively short-lived. Although we don't know exactly when it ceased to operate, the governor's minutes note that by May 1775 the brewhouse was in a ruinous condition, and 2 months later the brewing utensils were being disposed of. However, the malt shovel survived this clear-out and can now be seen on display in St Bartholomew's Hospital Museum. We hope you've enjoyed this video. We'd like to hear about your favourite item in the collections. You can search our online catalogue via the link below and follow us on Twitter and Instagram to tell us what you find.